So good afternoon, everyone. My name is Ellie Wishart. I am the Real World Evidence Manager for Healthcare Division of Ecolab in Europe. I'm passionate about how we support our customers with evidence, expertise and knowledge. And to that end, on this Global Hand Washing Day, where we celebrate hand hygiene for all, we're delighted to bring this webcast to you. Did you know that when you clean your hands can impact your health? Well, today we have two global infection prevention experts who will share their expertise and experience in hand hygiene with you. So we have Julie Storr, who is a global health consultant, co-founder and director at S3 Global. She's worked internationally for the last 15 years, predominantly as an expert with WHO on the development, implementation and evaluation of global improvement programs in patient safety, quality, infection prevention and control, with a focus on behavior change. We also have Claire Kilpatrick, who's director of S3 Global and has worked with the WHO at global, regional and country level since 2008, after working at national level in public health for many years. She works in infection prevention, water, sanitization and hygiene, and antimicrobial resistance in healthcare, including campaigns and development of guidance and implementation strategies. So I welcome you all. And before we start the webcast today, I would like to just make sure that everybody is aware that you can ask questions throughout the webcast. So if you have any questions, you can access the Q&A at the bottom right-hand side of your screen. And you can type and send your questions to all panelists. And so we will have time at the end to answer your burning questions. So with that, I welcome Julie and Claire to speak to you today.
Thank you, Ellie, and welcome everybody. I'm Julie.
And I'm Claire.
So we're delighted to join this conversation on this important day, Global Hand Washing Day. I want to start really by acknowledging the context of where we are. And of course, a lot of talk now about hand hygiene is in the context of COVID-19 because it's one of the strategies to stop it spreading to protect people. And we know it's important just to recap that in the community, in our day-to-day lives, we need a combination of measures to stop the spread of COVID-19 and other infections. And these include, and it's not exclusively, hand hygiene, physical distancing, the use of masks. Now, hand hygiene is undisputedly critical, but there are some challenges here. And share an example from one European country here of a poster designed to encourage hand hygiene. And this poster, as you can see, says, wash your hands more often for 20 seconds. I could have chosen a poster from any country because the language of hand hygiene often can be quite vague and ambiguous. So wash your hands more often for 20 seconds on the face of it seems a good message. Hand hygiene, undisputable in its role. Let's get people to wash their hands more often. But when you drill into this, what does more often mean? Why is it important?
So to start the discussion, we do want to take you back to that global level and that global context, because we have a lot to build on. So let's remember that we're already, and all of you I'm sure have joined today because you're already so passionate about hand hygiene. So we've got a lot to thank ourselves and congratulate ourselves on, and to recognise what we have. WHO states cleaning hands in the right way at the right times is one of the most important things. Julie has mentioned this is direct from WHO publications. We've got 15 years of global action on hand hygiene and healthcare, very much our experience. We present here just some of the resources that you may know from WHO that we've been very fortunate to be involved in over these 15 years. Guidelines, manuals, tools, briefings, and you can see here in the last year, of course, they have related very, very much to COVID-19. And I want to just take a moment now to say that today, in fact, a very nice new resource from WHO has been launched, which combines the narrative between infection prevention and water sanitation and hygiene to support this new initiative, Hand Hygiene for All, run by WHO and UNICEF. There's a lot there.
There's a lot that we've learned in the last 15 years and beyond from across the world, and many of you will have been part of that journey. The work that Claire and I have done predominantly has been focused on hand hygiene in the context of healthcare. And as we've seen this year, we're starting to shift that conversation towards hand hygiene in the wider community. And can we learn some key lessons from what's happened in healthcare? And of course we can. Influence in hand hygiene is complex within and outside of the healthcare setting. But what we do know is that hand hygiene itself is a behaviour that is modifiable. It's open to be changed and influenced. And we know that because hand hygiene influences whether infections spread from one person to another, getting clear on the when and the how is important. And that's why about 10 years ago, World Health Organization developed something that some of you will be very familiar with called the My 5 Moments for Hand Hygiene. And we'll come on to that in a second in a little bit more detail. But that was the start of something. It was the start of really trying to tighten up how we talk about hand hygiene, to really get this laser sharp precision, remove that ambiguity, and to really support the people who we were trying to influence to know exactly when they should do it. Because random hand hygiene is as bad as no hand hygiene at all. So how we talk about hand hygiene matters. Language is important. And we know that reminders on their own don't change behaviour, and we need multiple strategies, but the posters and the reminders need to talk the right language if we're going to make a difference and ultimately to save people's lives.
I want you all to hold on to what Julie's just said as we go through the rest of the session. The word of the day is moments. And we've done a lot of work around investigating into the use of that word moment, and it's actually quite what we call a warm word. It's a word that we can use as something in itself, a reminder, a way to engage with people. So today's word is moments, and we're going to concentrate on that as we go through. The principles of the WHO 5 moments, the image here is just one image. There's many others for different settings, but let's be clear. It's about, as Julie said, making it simple, making it personal, making sense of when things happen in a logical flow of work, something we will come back to for other settings. So what can we take from it? Yeah, indeed, talk about our workflows, our daily activities, our flow, and figure out when the when for hand hygiene is most critical, depending on the risks we're exposed to.
So before the 5 moments approach was published in the late 2000s, essentially in many healthcare institutions, and I worked as an infection prevention and control nurse in a big hospital in the UK, we were quite vague in terms of how we talked. We said hand hygiene was the most important thing. We said people should do it all the time and often and more often. And we gave long, long lists that were just created cognitive overload. So the 5 moments approach was this intention to look at clustering the moments so that they were easy to understand. The very use of 5 moments, you know, people remember 5 things. The use of a very sticky image. It was influenced by human factors, by behavioural sciences. It was influenced by neuroscience, and it was influenced by design as well. So can we learn something from this in terms of the moments outside of healthcare?
So for the rest of this session, we want to focus on some key principles. This is a recent publication from the British Psychological Society, and we proudly work with them to develop something unique, something that really wasn't being talked about. How do we take those concepts and that understanding and apply it to our daily lives? And this is a first step in that direction. And I want you to focus on another keyword now, although moment is word of the day. The other keyword is principles. There'll never be one straight answer to should I clean my hands then, because it depends on all the other things happening around you at that moment. So we urge you to take this today as principles of a way that we can start to spread the word and spread the journey of applying those moments to different settings. So this resource is a public-facing resource that talks you through the psychology of hand hygiene. There's also a professional version of similar wording explaining to public health people how they can understand these principles and help people go on this improvement journey. This resource includes learning how to clean your hands, which we'll just touch on briefly, but importantly, a step forward in talking about when to clean your hands in different settings. And it covers an approach around being prepared to be able to do that, creating your own plans, making your own commitments, and we'll come on and talk more about that, being able to educate, influence, and be kind. I think, again, some keywords that we all need in our world today. And very briefly, to help you understand how these psychologists came up with this very easy to read short journey through that resource. It was based on something here which looks quite complex, but something that's key if you're going to influence behaviour. You need to understand people's capability, their opportunity, and their motivation. Without understanding those three elements, you can't influence behaviour. So within the documents, it goes into more detail, but I think that's important to help you understand that the content and the principles explained are very much rooted in a proven approach to changing behaviours. So now we're going to do some questions.
So all of you, if you go to www.menti.com and use the code at the top of the screen, you can sign in so we can see all of your answers to the questions. So I'll give you a couple of seconds to do that. So what is your hand hygiene commitment? You should all see the question on your screen, and you can answer as you see fit or how you feel about your hand hygiene commitment today. So this is great to see the really key and important things that are coming forward in terms of what's front of mind for everybody. And I love protect is in there very strongly.
and that do not forget is very telling as well. So really key message, but how do we get to that point? So really, really good, interesting commitments, and I think what we will cover today will help people be able to achieve them.
Okay, so should we go to the second question? So you can refresh if you don't see this question come up. But the second question is, who do you talk to about hand hygiene in your daily life? So your family, your friends, your colleagues, your social media network, and strangers. Do you spread the word? Do you talk to strangers about hand hygiene?
You know, that's really great to see that, and I think there's also something to be said for what we often talk about in healthcare as well, a hand hygiene amnesty. I think we need to learn to be honest, and it would have been okay if people said, I don't talk to anyone about it, because I'm sure my family most of the time wish I wouldn't talk about hand hygiene quite so often, but that is really good to see, and I think it's exciting to hear that I know you're all very committed, I'm sure already, but that you're actually talking about it. And I think probably prior to COVID-19, we weren't talking about it as much at all. So we're going to share our screen again and go back to these principles and this new document and how we might take the principles from it to help us in our workplaces, home spaces, etc. going forward. It's hard to know just now whether people's workspaces really are just their homes, because we're all in difficult positions, but yeah, let's talk a little bit more about how we take those principles and go forward.
So just building on some of these, quite rapidly going to address the how, which it is important, of course it's important, you have to do it right as well as at the right time, but the main emphasis for the rest of the session is on the right time. But how you clean your hands is important. We know, as you can see from the leaflet, we've had colleagues and friends share with us that they didn't quite understand or appreciate how complicated hand hygiene was. And you know, some people have shared with us, and you'll see in the leaflet, the interactive leaflet, some people went on YouTube and looked at some of the technique videos there and tried to make sense of it. Some people have shared with us that they find it quite helpful to think about trying to bring the invisibleness of microorganisms to life. So again, you see on the screen, we've had people share experiences where when they're cleaning their hands, washing their hands, using a sanitizer, they imagine that the soap or the sanitizer is a red paint, and they're really trying to cover in their imagination every square inch of their skin. Some people can do this intuitively. You may not need to visualize it. We're all different. We all have different modalities that influence our behavior. But there's just one or two examples. So we're going to now try to bring to life what we have are these three different moments for outside of healthcare where we can make sense and reinforce and drive improvements in hand hygiene for the safety of us all. And these are the home moments. They are public moments and they're personal moments. Now this is a work in progress. This is a newly developed concept drawing on the 5 moments from healthcare. And so we're interested in your feedback. Please do share any thoughts in the chat as well as we go through this.
So to recap, and we've touched on this, but we want to drill into now what WHO already described to help us understand what's happening when we do certain things and why there's a moment for hand hygiene. So we need to focus those moments on a place where different elements, different things of risk come together. Now, we give an example here because of COVID times, people from outside one household, or what we're calling in some countries the bubble. We need to focus then on the activity that's going to happen. So you've already pictured the scene, it's a place and things are happening. That's why that dotted line around the 5 moments for hand hygiene healthcare posters, very helpful visual. There's a defined place and things are going to happen. An activity that involves touching items or others that you come into contact with. That interaction, all of those things together, require hand hygiene at key moments. And that means already to think about infrastructure. How easy will it be to use an alcohol hand rub or soap and water at that moment, and something that we still need to very much address. So that's a key principle. I talked already about the principles running through this document, but this is the key principle to take away in order for you to be able to apply this to different examples that don't feature already in this document. Again, some prompts. Now we're going to keep being quite bold and reinforcing that saying frequent and more often is not the answer. We're going to go on a journey together to change that narrative, that language. So again, some thoughts for you to take away with you. You need to take steps to understand the flow of activities that are going to happen in a day or a set period of time, and where those moments in your real world should be happening. You need to identify common moments. Now that might change, but you can take steps to identify common moments for your personal, public, home or workplace. You need to think of a way to remind yourself that the concept of moments embraces the need to perform hand hygiene every time, exactly where that interaction in that place and those activities are happening. And that can actually vary depending on what you're doing. For example, there could be numerous interactions at a set time when you're shopping, when you're in a tea or a coffee room. But these are key principles, I say, that you have to apply if you're going to understand how you can be as safe as possible and not just say, well, I will clean my hands more often. So let's shift our commitments from that to something more specific as we go through the rest of the session.
So we start with the home moments, probably the simplest, I would say. And, these are just some examples on the screen that we have shared. So one home moment we could say is when you leave your home. So after the last thing you touch, the door handle, pull the door shut behind you, you're touching the last thing in your home, clean your hands. So that was what we would class as a home moment. And essentially what you're saying is, I've walked out of the door and I'm safe. I'm good to go in the world. I'm a safe person. I've got a safe pair of hands. When you return home after being out in the world, you'll have touched lots of things, and clearly in those public times, as we'll hear in a moment, you'll have cleaned your hands at various moments. But when you come back in, that final thing, it's like saying goodbye to the world's germs and coming in through your door. The last thing you do before you open your door, clean your hands again. So those could be described as home moments. And then within your home, there'll be many, and clearly we're not focusing too much here on food hygiene or when you've been to the toilet, which are clearly times that you clean your hands, but this is in the context of COVID very much so. So after touching anything that you've just brought into your house, like a parcel, a package or a letter. So those are just some examples, and we can build a bank of examples here, but it's trying to get people to think, in my home, to stay safe, what do I need to do as I enter it, as I leave it, and when I'm in it?
And that concept, certainly that we've learned from healthcare, it's important that we don't over recommend hand hygiene because people won't do it. They have busy lives. They have to understand the rationale. So you can see that these examples and how Julie explained them are specific, because what you don't want is another long list. No one in their own home is going to continually clean their hands in their safe space. So these key examples are important. So don't ever feel forced to come up with these long lists of times. Remember the principles and think about the interaction and what the risk might be.
And then we move on to what have been termed these public moments, and that can also apply to anything you do outside of your home setting, essentially. So this is what we're seeing much more up front and in our face over these months. So before you enter a public place, maybe getting on a public transport, on a bus, on a train, going into the pub or into the supermarket, before touching anything. And also it's important to note that if you haven't touched anything since you left home and you clean your hands at that home moment after you've closed the door, then your hands in theory are clean. If you haven't touched your nose or mouth or your eye, haven't touched anything else. But this is all about solidarity and confidence. So cleaning your hands before you go into a supermarket, it can be a little bit symbolic. But we're doing it because we want to all feel confident and to reassure each other that we're safe. It's like giving these public confidence and safety messages. In terms of when you touch something in a public place, e.g. in a supermarket, we're going to come to that in a second. But also after you leave public places, supermarkets, the last thing you touch, clean your hands. And again, if we come back to some of the messaging around this and try to think, how does that relate to public moments? My personal experiences have been around getting on a train. You see lots of signs at the station saying clean your hands often. Now, I have not seen on any trains any hand sanitizers. The infrastructure there, it's down to me. So I carry the hand sanitizer around with me so that I can clean my hands in that particular public moment. We know that supermarkets in many countries have installed hand hygiene stations, but in other public areas, it's really down to us, and that can bring its own challenges. And I'm just going to hand over for another example.
Yeah, there's an interesting example where I challenged myself recently in a very popular large store here in the UK, and they've installed a lot of very good safety measures, and their hand hygiene sanitizer that they have is one of my favourites. You know, some of the stores you go in and you don't like the one that they're offering. So, you know, there are challenges, there are barriers all the time to our behaviours. But in this store, I lined up for a long time to wait to pay for my goods and noticed that things have crept in. Everyone's getting a little bored with it already. Hand sanitizers in some places, but as you're waiting to pay, they've introduced new stacks of shelves with Christmas items. And I watched everyone in front of me pick up, happened to be a candle, Christmas candle, from the shelf as they waited in line to pay. Very good marketing, fair enough. And I thought, oh my, that's interesting. Every single person's lifted up and had a look and smelled and put it back. And then I did exactly the same thing. Because as soon as I got to that point in the line, I was really interested to see the candle too. The hand sanitizer isn't there at that point where that store's decided to promote a product. So we have to be role models, we have to think about the principles of that interaction in a certain space, and of course take that responsibility ourselves. But I emphasise these examples to get you to start to think of your own, especially as we move through to talking about workplaces. For those of you in workplaces who are having to think about the risk of being in a confined space with a number of others for a confined period of time. I'm sorry.
Essentially, what we're trying to do in public places, in public moments, is think, what am I touching, or what have I just touched that could be potentially contaminated with another person's spit, snot, bodily fluids from the face? And that's what you should be keeping in mind. So can I clean my hands? Are the people who run this institution making it easy for that to happen? And if they're not, then our responsibility has to kick in. Personal moments are the third category, and essentially this is where it's all about us touching our own body and potentially contaminating our hands with our own spit and snot, and that's rather crude terminology, but that's exactly what we're talking about here. So before and after, anytime you touch your face, whether you have a face covering or a mask on, hand hygiene is critical, and it's for the safety of us all. After any time that you take off your face covering, before you prepare or eat food, after you've finished eating, after using the toilet, changing a nappy, sneezing, coughing, snot, touching your hands, after touching animals as well. So these personal moments, try to categorise them into slightly different to what we do in the home, what we do when we're in public places. So three categories. We may build on that, but at the moment that seems a nice fit.
And my commitment is going to be really to be kind, but to influence and educate others to clean their hands after they touch their mask, because unfortunately in too many stores that's exactly what's happening. People are touching their faces much more than they would if they weren't wearing masks, and they're touching, and that as Jill said, that mucus, that germs, the spit is at risk and is being spread, and we have to influence that, there's no doubt, and I think that's something that is definitely a gap in our current.
I mean, we're seeing already people even using masks to convey messages, often humorous, but I mean, I don't know how many of you potentially have or have seen masks used to promote messages of hand hygiene. I mean, this save lives, clean your hands. This is a perfect opportunity to combine reminders with a piece of personal protective kit.
So we started with some questions earlier in this journey, and there are many, many more, thinking about the barriers that arise in your world, thinking about in the context of COVID-19, specifically following those moments we've explained, worked on with these psychologists based on this WHO theory. When do you think those moments should be? But there are key questions from these psychologists that really work to remind us. So there's a lot of principles here, but there are a lot of prompts, and these are the next round for you, the reminders. Have I just touched something that could be contaminated? Am I about to touch something? Am I about to do something? So 3 key messages. Joe's already explained these. In the resource that we've shared with you today, this is exactly how they're worded. So we're going to just rapidly now talk about that concept that allows you to address capability, opportunities and motivation. And everything takes preparedness, doesn't it? You have to think through ways to be prepared for what you might be faced with, to apply these principles. So within this resource, we've got some examples, some quotes, again about touching door handles, and in order to get to the sink to even wash hands. The family all come through the back door now in order to go past the sink before going near any other items in the house. So that's a good human factors change to how those people in their homes decided to enhance their hand hygiene. You'll need to think for your situations, workplace included, what could you put in place, what could you do to make it easier for people to clean their hands at the right times. So the examples are here in the document. How could you remind yourselves and those you might live with? How could you give praise when hands are getting cleaned every time at the right time? Start a competition. If you're going to a new place, do you know where you'll be able to clean your hands? There was an obligatory note issued by WHO earlier in the year. Some of you may know this, but this is very important that WHO said that every public space, every public building, even if that is a workplace, should have access to a way to clean your hands. And of course, often at a door, it is a hand sanitizer.
And I think, you know, these flow and build on each other, but, you know, creating a plan to, you've done a bit of preparation, you think you've put your sanitizer in your bag, your handbag, your pocket, in the car, by the door. But if you do have flaws in your memory, which I sometimes have and forget, then really try and strategize and think, right, well, what is the one thing I never forget to take with me? And it could be keys, it could be your phone. So for me, I leave a little bottle of hand sanitizer next to the mask, next to my phone, because I always take my phone out everywhere that I go. And if on the one occasion where I may have not taken the hand sanitizer, not only do I feel naked, but I then have to come up with a strategy to cope with that. And it's, if I forget to take my hand sanitizer with me, I will consciously try not to touch my face for the entire duration until I get to a place of safety where they have the hand sanitizer. And that's where, from this psychological perspective, and this is why it was such a pleasure to work with a group of psychologists, this is an approach that you can take to really help you remember things. This is the if-then approach. So if I pick up my keys, then I will check that I've got my hand gel. If I've touched a surface in a public space, then I'll use my hand gel. If I leave my home, then I'll take my hand gel. It's this if-then all the time. Write it down, make a list. And from the word cloud, it seems that many of you are on that journey already and starting to routinise this way of thinking. If we had talked about making a list of if-thens a year ago in regard to hand hygiene, I think I would have thought the world had gone crazy. But we're in a different place now. If I sneeze or cough and I forget to use my elbow, then I will clean my hands.
So we started by talking about commitments, and some of your phrasing, as Jill said, was really useful. And the psychologists again remind us that a commitment means something quite important. It has to be something tangible that you can demonstrate you've done. So, you know, think it through, write it down again, post it on social media, talk about it, and be very strong. I will, in the example here, follow effective hand hygiene, clean my hands well. It's quite long, that example, but really important. And the beauty and the power of such commitments that people decide to make together makes you feel part of a community. And this touches a little bit on campaigning and the element of even mini campaigns that you will introduce in your home, in your workplace. But that campaigning theory and commitments as a part of that is really powerful, because you feel a sense of belonging, you feel you're all in it together, you feel proud, you identify with it. So use the power of these things as you go forward.
And I think, yeah, there's a couple of things here. One thing from the world of improvement, we know that people like Sarah Fraser, who have done a lot of pioneering work on quality improvement in healthcare, her mantra was, if something gets talked about, it gets done. And I'm sure that's borrowed from other giants, but that's kind of true in this instance. The more we talk about this, the more we can't ignore. Hand hygiene was invisible almost until COVID-19. We've made it visible. We need to build on that, make more of the commitment. And this draws, those of you who are familiar with the UK will know that there was a big campaign around the antibiotic guardians, people feeling empowered to speak up about overuse of antibiotics. And they made a pledge to be antibiotic guardians, to have that sort of commitment to act, to influence. And we've drawn on some of this thinking for this. So one of the things that annoys me hugely is when we say hand hygiene is the simplest thing, because it actually isn't. It's not difficult, but it's complex. And all of these measures that we're talking about, they're not easy. They're easy to say, but hand hygiene behaviour change is a challenge. And so even though you may think some of these things are happening all around us, we know that they're not. From research, even now, that's breaking. Yeah. So we know that we've got to keep on these, we've got to win these little battles, and we've got to make those commitments and be role models, because we can influence how other people behave.
So lastly, and we're just going to whiz through and get onto the questions for sure. We mentioned that the resource includes information about educating, influencing and be kind. So we urge you to have a look at that and remember that mantra as well, and how it is just building what Jules has said, how we can be role models. But to finish, now is the time. I deliberately want to refocus on that key principle that allows you to have your moments. The place where different things come together and the activities that are involved that mean you need to clean your hands. And we've talked about lots of examples. But there's a long journey to go here to take these principles into a new world, as we've said. It can be complex, it can be time consuming to work it through at that level of detail. And Jules and I have worked on this for many years in healthcare, asking clinicians what they do step by step in their workflow before even talking to them about hand hygiene. Hand hygiene isn't the message, it's what do you do, let us help you understand your risk. And then you introduce the hand hygiene steps. That's the journey we need to go on together now, because the long lists are not the answer. Overdoing the hand hygiene and insisting in it too many times will turn people off. So together, let's think, what will our and your moments be, whether it's in a restaurant, whether it's in a hotel, an office, your industry, your workspace, and how will we, as I say, go through this journey together from here on. And we really look forward to a lot of that feedback. So it's Hand Hygiene, Global Hand Washing Day, and my apologies, and we want to emphasise again this Hand Hygiene for All initiative that was launched by WHO and UNICEF earlier this year. This is really ramping up the power of the messages, something we can all take advantage of. And also just want to encourage you to look out today from new messages from WHO. We've worked with Disney, the Disney Corporation, and created lots of new little cartoons for kids in particular, all about hand washing. They're brand new out today, and I think it's always nice to see these new resources. And we will finish there. Thank you.
Thanks, Ellie. Thanks, everybody.
Thank you so much, Claire and Julie. So much to take home. I love the idea of bringing these moments to our personal life, to our workplaces. As we've been working in hand hygiene for many years, always learn some great stuff from both of you. We have had some questions, so I'd love to pose some of those to you. So questions that are obviously burning in everyone's minds, but we do have, so I suppose specific questions about, you know, touching your face. So why is it dangerous to touch your face? As long as I don't touch my eyes, my nose, or my mouth. So if I'm being careful not to touch those areas, can I still touch my face?
Oh, that's really good, and thank you for raising that, because this is about language and how we talk. Absolutely right. It's not about not being allowed to touch your cheek if you've got a little scratch. It is about where those mucous membranes will come, of course, or the risk to you as well. So yeah, of course, your mouth, your nose, your eyes. Very, very good point. Yeah, and maybe we need to be better at that language rather than saying face. Absolutely.
Yeah. We shall feed that back.
Yes, we'll feed that back indeed to all our colleagues. Yeah.
So another question, and this one you both are very familiar with, but it is something that I think atop a lot of people's minds, as well as hand washing. Is there a benefit from using gloves on sites and in public places?
So we could actually start a whole other session on this now. It's very, very dear to us. I'll let you go first, and then we can add.
I think that question actually generates to me a million other questions that I want to know the answers for. So I want to know why the gloves were thought to be the answer to something. What are they the answer to? Is this to reduce the level of hand hygiene, or is this gloves to be worn and then removed frequently and then hands cleaned after certain activities? I'd really want to look at the flow of what was happening when the gloves were being put on, why they were being put on. What I see as an anecdote is, in some institutions, I see gloves used by people operating the checkout, and I see those people never cleaning their hands. So they feel safe. And I think this is the big challenge with gloves. They make you feel invincible. It's like the headgear in American football. You put the pair of gloves on and you're not going to contaminate yourself with others' germs, but you're not protecting your colleagues, you're not protecting the customers if you don't change those gloves after every interaction or after every time you touch something where hands should be cleaned. So gloves can be abused hugely. So we need to know why. We need to know if they interfere with hand hygiene, that's bad.
From all the studies that have been done, and this is clear, WHO is very clear on this, as are other leading institutions, gloves never replace those moments, the need for hand hygiene. They never do. They in fact become your second skin, so it's no different. But we have a challenge there, but many, many papers on that. Many of our colleagues have studied this, but there are some nice statements already existing out there about how they are not the answer. But indeed, it's again a behavioural thing, and maybe a recommendation we can take to our psychology colleagues around how we might address that next.
I think we have to acknowledge, from the behavioural psychological perspective, people in the context of COVID are scared. A big strategy in the early days was deliberately to scare people. When people are scared, they just want to be protected and they want their own safety. It's the innate sort of, fight or flight thing. And it seems logical to wear gloves. But if you then pick that apart and then try and help people understand that hand hygiene is okay, it's powerful enough, and the gloves can introduce more harms than good. But it's a challenging conversation to have, because people often, they're just so terrified that they think, I'm going to protect myself at all costs. So it's a huge challenge, but we would never advocate the use of gloves as a cure or over hand hygiene. Yeah, never. And in fact, if I see people wearing gloves in public places in hospitality, I feel less safe than if I see, if I go, you know, I occasionally go to a hostelry and partake in a drink, and I feel so great if I see the staff cleaning their hands at the right times. It makes me think, I like this place, it's safe, it's got a good culture, I will come back here.
And in fact, the culture of where they're encouraging others to as well in a very positive, influencing and kind way. People that are doing it and talking about it, you know, they're the kind of big ticks for places you might want to go if you are frequenting public spaces.
I think we should be feeling confident when we hear people talking about it in the trade sector, in hospitality, and it's almost like an indicator of the culture of safety, I think.
Thank you. It's generating more questions as we speak. So when we talk about hand washing, is there an optimum water temperature to use when hand washing? This is probably something you're very familiar from healthcare again, but do you think there's an optimum temperature you should use?
Sure, and in fact, the WHO documents say warm water, so it's warm water. However, you know, we also have situations where we have to, for low and middle income countries, adapt our strategies, and we've spent a lot of time on that this year with regards to available resources. And in fact, there's even been situations where we've had to say, if you are in this situation, water alone, even if it's cold, will do a degree of removal. That physical action, remembering that hand washing is like a physical action, slightly different to that alcohol hand job approach, even though there's still steps to be performed. So warm water with soap and clean towels is the word out from WHO.
Yeah, there's a lot of studies done many years ago by people like Elaine Larson, you know, the gurus of hand hygiene, that too hot, too cold, bad for the skin. Therefore, if your skin's not looked after, you're less likely to clean your hands. So yeah, just warm water. They kept it very simple, WHO.
Yeah.
And thinking about the workplace, what do you think the barriers are to getting people to perform hand hygiene? What do you foresee as being the challenges that we need to kind of overcome?
So I think we're going to extrapolate from healthcare again, because I think we're dealing with human behaviour. So there's no doubt that what we've learned over all these years, a lot of these things can be applied. So firstly, we think about the infrastructure. We think about building the right environment, overcome any barriers, and we've mentioned this a little already, overcome any barriers about where you may be able to clean your hands. And even in healthcare settings, some of the best in the world, you can go to a hand rub dispenser and it'll be empty. You must put in step-by-step processes that everyone buys into to avoid those pitfalls. It will just turn people off. That culture is not being demonstrated by a workplace that they value hand hygiene because it's empty. There's no system to fill it up. That's one example. Obviously, depending what country you're in, we're working in water, sanitation and hygiene deliberately to try to look at different infrastructure and where that's required for, you know, settings with practically nothing. So build your systems to make sure they work, or you will have barriers. But I touched already on that safety culture, and that's another key thing. People all these years have asked us the answer to the right culture. This is where, for hand hygiene, it's very locally contextual. So for all the things around building it and infrastructure, we can give you the answers and the standards. All around how to teach it, we can give you all the examples and how you target different audiences. We can talk to you about monitoring and how's the best way to do that, and we can talk about that for another whole week. And we can talk about something I'm sure many of you are experts on, which is how we get the right reminders to people, because we need all of those things together to change behaviour. But the culture can be dependent on where you are. It will be very different things to very different people. But we know we need leaders who will demonstrate and role model. But those leaders might not be the most senior person. They might be the most junior. A key element is asking people who they think are their influencers. Don't assume. Just like asking them where they do their workflow, where they want the sanitizer placed is so important. We never, as much as a lot of us might think we are experts, never make those assumptions. We worked again in healthcare in the US with colleagues, and they did a great project in ICUs, and they asked the nurses what they thought about where the items should be stored, what would make their jobs easier. And those nurses said it was the first time anyone had ever asked their opinion about how to make their workplace easier for them. A really, really busy workforce had never been asked, how can we make it easy for you to insert a line, clean your hands, clean a patient? So do remember, when you're thinking about breaking barriers around culture, there won't always be one answer. You will have to do the investigations at that local level.
And I think, just to jump onto that as well, the term, certainly in some countries, the COVID champion term, this term of having somebody who's the cleanliness or the hygiene or the COVID champion, isn't a new approach to safety. Other industries have used that for many different aspects of health and safety. But the reason they're using it now is because it works, but it works only if it's lived out. So, where in your workplace, identify somebody who can be the COVID champion, the safety champion, the cleanliness champion, but empower them to take the steps to make the infrastructure work, to do the monitoring and the checks, and for the managers to value that role and to listen and to act on the feedback that's received. So yeah, there's lots of things, and I think multifaceted, multimodal, and all about the culture and the leadership as well.
Thank you. Inevitably, we got questions now, or I'm seeing questions about, what kind of products you should use. So is there a minimum amount of alcohol, for example, you should look out for in hand hygiene products? In our public lives, we see, as you say, a variety of different products. Can you answer on that one?
Sure, of course, and again, all very much based on the evidence and published by WHO back in 2009. And important that we get these things right, and I think we'll probably all be a little honest and say some of the products in public spaces, we've no idea what they are. And Jill's and I have little competitions to try and even guess if there's any alcohol content at all. Now, I'm not going to promote a particular product, and this is not my real area of expertise. But I am very passionate about the evidence from WHO, and until that changes, we will be promoting 70% alcohol in the products as standard. Now, there's a range, I think it says somewhere, Ellie, you'll probably know this, between 60 and 80%, and that's fine. But that is, we're very, very passionate about that. That is so important until we know otherwise, not belittling other people who feel that alcohol's maybe too harsh, or I do not agree at all. But there are people working on different things, and I respect that. But our stance will always be around that recommendation from the science until we know. And remembering that things like a palm full is the recommendation. Don't get too caught up with, am I using enough, am I not using enough? A palm full that will suit your hand will work in covering all areas. So yeah, but let's just stick to the facts that we know. But again, challenging, because there are a lot of new things emerging in this time. But I think, again, we have to be role models and not sort of break from that science until we know otherwise.
Thank you. And it is a common question about making sure people want to make sure they're using the right things and using the right amount. So thank you for answering the question about amount. Enough for your hands. It's not a specific amount of milliliters.
And sorry, Ellie, I just wanted to say quickly something that is a real barrier that comes up around product use, and I refer to Professor Didier Boutet, who much better answers this question. But people often think that because they're using the hand sanitizer, that's their hands are being damaged or are drying out. The good products will not do that to your hands. We've also found that when you start along a road of hand hygiene promotion, people tend to wash their hands more as well as using sanitizer. So it's actually coming back to these moments. We do not want to introduce new barriers in our messages about hand hygiene, because doing it too often will put people off, may damage their hands. What you find often is that soaps can actually be a lot more drying than alcohol hand sanitizers, but because people think they've introduced a sanitizer to their life, but they've actually taken steps because they're fearful, whatever, to wash their hands more as well, they may see some hand damage. And I think, again, we have to be strong. There are nice little surveys around tolerability of products that you can walk through. You've got to remember your hand care, especially for those of us going into winter. So let's find solutions rather than put more barriers in place. I think all of us, as you know, really passionate people that have joined along today.
Thank you. And as I said, this has created lots of kind of thinking from the audience, and I think probably one that will come out as people start thinking about is, again, coming to which should I use, which should always be the first choice. Is it hand washing or is it use of hand sanitizers? What are your thoughts on that?
So again, we can quote healthcare and the strong evidence from all of the studies that have been done over the many years, which says that alcohol hand jobs should be the gold standard, should be the approach to hand hygiene. And then you wash your hands where there's soilage, where you've been exposed to, you know, significant sort of blood body fluid issue. It's not, again, that we are going to go down this road of like being absolute zealots about alcohol hand rub, but it's about behaviour. It's about being able to do something at the right time.
Yeah, it's about those moments. So Claire said the mantra today was the moment. So you think about all of those moments really, but particularly the public moments, which is where we're potentially meeting and coming into contact with other people's secretions. You don't tend to get many sinks with running water on a bus, on a towel, on a train in the middle of a big supermarket, you know. So this is why, for me, I was converted to promoting point-of-care hand sanitizers back in the late 1990s after reading Professor Pitte's paper and hearing about his work, because it made sense from an ergonomic point of view. The health workers who I was working with couldn't easily get to the sink in a very, very busy flow of work, but they could reach inside their pocket or reach out to the end of the bed and squirt and make their hands safe and clean. So it's a complete no-brainer to me, the power of hand sanitizers, because they enable you to clean your hands so that you're safe where you need to clean them. You know, that precision, the right time, the right moment. And for me, I cannot see how washing with soap and water is feasible for many of those moments. When I've spent a lot of time walking during lockdown and walking through fields where I will touch gates, you know, and climb over things which other people have touched. I've never seen a sink with running water and towels by the side of a gate. So I take my hand sanitizer and I'm safe.
Perfect. Thank you so much for answering all those questions. As you can imagine, lots of questions are coming, and I'd like to assure everybody who's attending today, we will send out a summary of the Q&A that were answered and some additional questions that we got, so you get those and you can understand and think back on all those burning questions that we had. So I just want to take the time to thank all of you for attending, and thank you for making the time to come and listen to Claire and Julie today. I think you'll agree, lots of things to take home, literally home moments, lots of things to take to our workplaces in terms of how we think we protect ourselves and the people around us. So thank you all for attending, and thank you both, Julie and Claire, for your expertise today.
Thank you to you, and thanks everyone. Thank you.
Thank you.